let's look at meningitis A, let's look at the orphans in Kenya. What are let's pull out some of the learning with those two and the kind of many other case studies in Millions Saved. The cases seem so disparate, but what are the kind of common themes that came out? Because this is really important if you want to think about how to scale up future programs.
Yeah. I think one of the first issues is around the use of data and rigorous impact evaluation, both to understand if the program is working or not and to feed back and change course if needed. So that's a very key issue that you see across a couple of the cases.
So you use the data not like an academic exercise, but to actually change course while it's still happening.
That's right. I mean, we relied on academic studies, but it wasn't about the studies. It was about feeding into the management of those programs. A second has to do with partnerships and coalitions. In a number of cases, we see governments in the lead, but a lot of partnership from official aid sources, from philanthropy, from technical agencies like the World Health Organization and UNICEF. So it's really coalitions of actors coming together to achieve a particular goal. And I think it's really important because sometimes you go to a lot of global health meetings. There are too many meetings. You have the feeling that coordination is not working. These stories are about international coordination really making a difference in people's lives. Great news, I think. A third issue is around leadership across the political cycle. So, and this has to do too with the data and evaluation. When programs are well monitored and evaluated, they basically give a good reason for political leadership to continue that program. Sometimes the programs change names over administrations, but evidence is its own, results are its own reward, basically. So that's another key issue. And probably the fourth and most important lesson from all of the cases is that the delivery of these cost-effective interventions matter. So we might look at something at small scale and know that it works to reduce disease. But unless that is delivered effectively to those who most need it, it won't change health outcomes.
At large scale, when you scale it up.
At large scale, exactly. So that is a really key lesson learned.